I think we're just waiting on a few more people, but just to give everyone that is present, we heads up, this meeting is just being recorded for our own purposes, but just to give you a heads up. I think we're expecting a few more people, Claire, but if you want to get started at any point, I can make sure that they can get in okay and stuff like that.
Brilliant. Okay, I'll make a start then. Well, first of all, welcome and thank you everybody for joining us to talk about how we can work together to improve the experiences of families with special educational needs and disabilities. Just to briefly introduce myself, my name's Claire Richmond. I'm one of two London region representatives of the National Network of Parent Carer Forums, or NNPCF for short. And we're a network of up to 152 local area parent carer forums in England, with a combined national membership of over 128,000 parent carers. And our role is to work in strategic partnership with local, regional and national health, education and social care services, with the view to improve those services for children and young people with special educational needs and disabilities, or SEND. We're led by a steering group of 10 parent carers representing the forums in each of the 9 regions of England, and we have 2 for London. And if you want to learn a little bit more about what we do, you can visit our website at nnpcf.org.uk. So we all know the challenges that we're operating under at the moment, challenges of funding, challenges of skilled workforce, and in the face of escalating need of children and young people with SEND. But that doesn't mean we can't still make improvements. And one of the places we can improve is the way that we work together to make best use of the resources that we have available to improve outcomes. And there's different types of working together. Some of those are here. They're all valid. They all have their place, but they're all different. So information, sharing information with stakeholders, participation, involving stakeholders, feedback, gathering the views of stakeholders after taking action. So we've introduced this service. What did you think? consultation, gathering the views of stakeholders before taking action. So we're thinking of introducing this service, what are your views? And co-production, which is a way of working together in equal partnership that shares decision-making power and accountability. And broadly speaking, we have the best grasp of those participation, feedback, consultation types of engagement. Not to say there isn't always room for improvement. I think we're all always aware that we're not talking to infinitely more parent carers than we are talking to, but that's where we're strongest: participation, feedback and consultation. And where we most often encounter difficulties are at the information and co-production stages, and that's what I wanted to focus on a little bit today. So thinking about information and thinking when we're working strategically, thinking about strategic engagement with parent carers. And one very simple but very big change that professionals and practitioners could make is to make sure that the first version of an information resource is accessible. And what often happens when parent carers are working in strategic partnership with statutory services is, in the first instance, we're given documentation that's jargon heavy, has a lot of acronyms, that isn't perhaps in the most accessible format. And when we challenge that, we're told, don't worry, we're going to create an easy read version of that once we're finished, which is great. But one of the downfalls of that is that it creates barriers to engagement. So automatically we're disengaging certain aspects of the parent carer community. For example, you might already need to have a really strong understanding of the SEND framework to be able to participate. You might need a professional skill set to be able to participate if those information resources aren't made accessible in the first instance. So that's one very simple but very big change that practitioners and professionals could make. When thinking about individual parent carers, and thinking about what information is available to them, we need to consider that when statutory services don't provide it, that parent carers will find it elsewhere, and that presents some risks as well. So in preparation for today, I did some research and I explored information resources, talking about the Change Programme Partnership, which is quite new. It's an area where parent carers still don't feel they quite understand what's going on, and perhaps information resources and communication hasn't kept pace with activity. So I first of all went to social media, and in the search bar, I put Change Programme Partnership, and what came up, the first three things that I encountered was first of all, a post from a SEND campaign group, which in the very first sentence was talking about the Change Programme using negative terms. The second post was from a local area statutory service where it had some good information, but it was a bit lengthy and didn't draw out the key points in the way that you'd expect a social media post to do. And then the third post that came up following the search was actually about the government's attendance strategy and campaign at the moment, and that was talked about in negative terms and with terminology that was likely to be triggering for parent carers. So when parent carers are left to go and search on their own, the results can vary. Going to an internet search engine, that was much more positive. The very first resource that came up was from a national voluntary sector organisation with very clear, very neutrally presented information that would fit on one side of A4 and told parent carer everything that they needed to know in very simple terms about what the Change Programme partnerships were. Going down a few more search results later, again less positive, with the third or fourth being a link to some helpful information, but that actually used some quite inflammatory language, and that came with through the lens of sort of skepticism about the programme. So the difficulty here is that when statutory services don't provide up-to-date and accessible information and parent carers seek it elsewhere, that can come through the lens of scepticism and with an opinion already baked in. And not to say that our SEND campaign groups and other organisations don't do a very useful and important job, but when they are the only source for information, you can be front loading your conversations with parent carers with some skepticism, with some suspicion, and with anxiety. And I think that's the one word that we need to bear in mind when thinking about an absence of accessible information. It causes anxiety, which doesn't help our working together. So please don't leave an information vacuum. Diversify the way that you're sharing information. If it's all there on the local offer, don't just leave it on the local offer. Have social media posts and posters and videos and other ways for parent carers to access information, and keep sharing, even if it's to say there's nothing new, there's no update, but it's still on our radar, it's still being thought of, somebody's still taking care of this. So moving on to co-production, I'm going to try and speed through these slides because I think we all have a much better understanding of what co-production is and isn't than perhaps we did a few years ago. But co-production removes the hierarchy of knowledge, so professional expertise and lived experience are both valued equally. It shares decision-making power between those who draw on care and support and those who provide it, and that can be quite scary, particularly at this time when budgets have never been more challenged, and it can require some courage to share the reins of those budgets with parent carers, but that is an inherent part of co-production. It's accessible to everyone that will be affected by the output. That's all stakeholders, whether professionals, statutory services, parent carers, children, young people. And it should be happening at both a strategic level in terms of service design and delivery, and also at an individual level, working with a child and young person and their family to co-design their support and care. And most crucially, and this is often where it falls down a little, it has to begin before decisions are taken, before decisions are made or actions are taken. And what sometimes happens is that statutory services want to work in co-production with parent carers, but find that actually they've already made a lot of the decisions before they involve parent carers, and we've missed that opportunity to genuinely co-produce. Why is it important? It's a statutory duty for everyone that works with children and young people with special educational needs and disabilities. It's referenced in the Children and Families Act and Code of Practice, Care Act, to name a few. And it results in better services and better outcomes for children and young people with SEND. It's as simple as that. During the planning of the 2014 SEND reforms, it was found that local systems that worked in strategic partnership with parent carers had better services for children and young people with SEND. So what are the barriers? Here are a few common ones. Timing. It takes time, and it isn't always possible, and we need to be transparent and realistic about that. Timing in terms of when we involved families in decision making, and more typically that happens at the moment when we're partway through a process or towards the end of the process, and that's the cultural change that needs to happen to normalise working with parent carers and children and young people right at the beginning. Expectations differ, and sometimes the term co-production is used inappropriately, and that can cause tension between parent carers and professionals and practitioners, and that's because of accountability. When we have co-produced a piece of work with the service, we expect to be held jointly accountable for the outcomes of that, and that's fair enough, and that's part of co-production. However, when a project is mislabeled as co-produced, it means that we're taking on an accountability that isn't fair or justified, because we haven't had that opportunity to equally influence the outcome. And accessibility, locations, days, times, methods of engagement. There needs to be a variety. Some parent carers work full time and can only be available in the evening. For some, face to face works much better. For others, virtual is the only way they can engage. Understanding those barriers to engagement and uh, making the accommodations necessary so that everybody can be included, accessibility of information resources, and also supporting the additional needs of parent carers. Dyslexia, neurodiversity, English as an additional language are some of the most commonly occurring additional needs of parents, but that list isn't exhaustive. And there's a little bit of a checklist for you there if you're trying to consider, is this co-production or isn't it co-production? So some values and principles of co-production for you to consider there when considering what label you're going to give to a type of engagement. I'll move on to the next slide because I'm aware we're a little bit short of time and I really want to talk more about the practical examples of co-production. So this was a piece of work that I was involved in my local area. And to give you a little bit of background and context, when we started the most recent version of the Parent Carer Forum in my local area in 2019, we were starting from quite a difficult place where the relationship between the parent carer community and statutory services was very strained. And right from the beginning, what we did was we set up a monthly meeting between the Director of Children's Services and a few other strategic leads in the local area and the Parent Carer Forum senior leadership. And we met with no agenda. The idea was to get to know each other, to build trust, and to just be able to openly talk about the issues in a private space. And there was no output expected from that in the first instance. And that's one really important thing that needs to happen if you're going to regularly co-produce with parent carers. To make that space in your schedule, to meet regularly without a particular objective or outcome, because that's the space where a lot of genuine co-production comes from. That's where the ideas come and the identification of shared priorities. So in those conversations, those local conversations, two issues came up regularly. Those were around SEND transport and the dissatisfaction of parent carers with a lot of the local practice, and the local area sharing with us in a transparent way their challenges in terms of providing that service and making those difficult decisions about things like journey times and regularly changing providers and things like that to ensure best value for money. Another issue that was regularly raised was regarding short breaks and respite care, and a perceived insufficiency in the local area in terms of the amount of respite available to parent carers. And again, the local area's acknowledgement that, you know, in an ideal world, of course, we would do more, but we have to ensure the quality of what we are offering and ensure that those with the highest level of need get the highest level of service. And out of those discussions that initially did focus on the bits that we can't do, we came around to well, what can we do? And in our conversations with parent carers, we found that as much as respite was needed and necessary, what they wanted to do was to do the things that the vast majority of families do. They wanted to be able to go on day trips and to give their children and young people those wider experiences of the world that most typically developing children and young people were experiencing as a matter of course, and that for our families were very, very tricky, and that one or two difficult experiences were enough for them to say, right, okay, we can't do this isn't for us. And also talking quite frankly about the fact that the staff in the transport team were more often than not having difficult conversations with parent carers, and that was quite bad for staff morale. And what came out of this was the idea to use the local authorities' home to school transport buses during the school holidays, to transport groups of families to send events in central London where it wasn't very resource heavy because those children and young people would be in the care of their parents, so we weren't providing specialist staff, but that actually they could do something that perhaps they wouldn't have felt safe to do or had the opportunity to do just on their own. And that's another important aspect of co-production. Talk is great, but at sometimes it's got to turn into action. And there was considerable trust from the local authority in terms of allowing us to use their resources, in terms of it being genuine co-production. I will hold my hands up, and the forum did run away with it a little bit. So we fell down a little bit with the shared decision making and accountability, because it was the forum that led the way, and the local authority took a bit of a back seat. So that's some learning as well. That's really important in co-production, because one space where it does sometimes fall down is moving at a pace that works for everybody. That's really tricky, to make sure that nobody's left behind, but also that you don't lose momentum with the project. And also external factors. For example, some funding has to be used in year, it can't be carried over. So that's a real challenge in co-production, finding that balance in terms of the pace and making sure that everybody's supported to keep up. We didn't quite get it right on this project. And the other thing that perhaps we could have improved on was we didn't go back and evaluate and decide what we'd learned from it and what the next steps would be. The outcomes were that we were able to start embedding that practice of partnership working and that practice of trusting each other and working together, and hopefully positive experiences for everyone. Both the pilot and the event were an enormous success, and the children and young people that participated really enjoyed themselves. Parent carers really enjoyed the peer support and feeling safe to try something new, and broaden the horizons and building the independence of children and young people, which is so important in that preparing for adulthood journey. And I'm delighted to say that one young person that joined us with their parents was ready to leave a little bit earlier than everybody else, and for the first time ever that family attempted the journey home on public transport and managed that really successfully. So that was a really great outcome in terms of those preparing for adulthood skills, and also the building the resilience of the family. So the takeaways from that are to think about space and pace. So make space in your schedule to meet with parent carers regularly, but without an expected outcome or agenda. That's really difficult when we're all working under such time pressure, and it's hard to create space where there is no short-term goal, and perhaps doesn't feel productive in the first instance. But I do promise you, if you stick with it, that's the space where genuine co-production will come from. Again, pace, thinking about how we manage that, and we go at a speed that works for everyone. In the example I've given you, it was the parent carer forum that ran away with the timeline, but in most instances it will. What we hear from parent carers is we started off at a good place, we started working in a co-productive way, and somewhere along the way we felt like it was happening without us and we got left behind. At the same time, I'm sure that statutory services and professionals and practitioners would say, you know, sometimes we've just got to make things happen. And finally, be brave. It was pretty scary rolling into central London with a bus full of families with special educational needs and disabilities, having not done it before. I dare say for the local authority, they were a little bit nervous and were very much trusting us not to do anything silly that would ultimately have resulted on blowback on the local authority. To co-produce, everybody needs to be willing to step outside of their comfort zone a little bit, and that can be scary, but it is necessary. And finally, massive thanks to the Postal Museum and Ambitious About Autism. The post-early events for families with special educational needs and disabilities are made possible by those two organisations working in partnership with each other. So another example of strategic co-production can be in the staff recruitment process. And just wanted to talk a little bit about whether that is an opportunity for co-production or for participation, because it can be both depending on how you approach it. So the first question to ask, and I'm a bit boring about this, but I do strongly believe that if you know why you're doing something, you're clear about that, the how becomes a little bit easier. So first of all, why are you seeking parent carer involvement in the first instance? It could be that it's simply, you know, we want to work more closely with our parent carer community, and this is an opportunity to do so. Or you could have a really clear idea about what you want to be different or better as a result of parent carer participation. But asking that question right at the beginning, why are we doing this, is really important. The second question, how early in the recruitment process have you engaged with parent carer representatives? And we heard about some really great best practice recently where an outgoing post holder met with the local area parent carer forum to talk about what was involved in the role and what sort of personal attributes that a new post holder might need. And that's really enabled that local area forum to meaningfully participate in the recruitment process. Should we recruit? Going right to the beginning of the question, there's some roles that the local area has an obligation to have someone in post for, but in cases where they don't, you know, should we replace the person that's leaving? Should that job role look the same? Do we need have things moved on? Do we need something a bit different? What are the personal attributes of the person that we'd like to see in that space? And going out to advert and then compiling a shortlist together from applications. So have you involved parent carers at that very, very early stage where there's greatest opportunity for them to meaningfully influence the process? Also, have you been transparent about what's involved in any constraints that you're working under? For example, if you're going to shortlist 5 candidates, that's potentially around 10 hours of time that a parent carer would have to commit to preparing for and sitting on those interview panels. And it would have to be the same parent carer in order to make that recruitment process fair. So have you been transparent about what's involved? Perhaps there's issues of confidentiality. You might have to ask a parent carer to sign a non-disclosure agreement, or there may be some basic training in HR and recruitment that you would expect them to undertake. So be really clear about what's expected and what's involved right from the beginning. One crucial question, it can be the defining question in terms of whether you're co-producing or participating. To what extent are you able or willing to share decision-making power? And if you take an example where you have a vacancy in a post, perhaps it's existed for a while, it's having a negative impact on the service, it's having a negative impact on staff wellbeing and morale, there's really some urgency to recruit to this role. And you have a short list of candidates that look absolutely fine on paper, and providing at least one of them scores satisfactorily at interview, the view of the professional stakeholders is we really must recruit in this round of recruitment. So in that sense, not that it's a fait accompli, but the ability for parent carers to influence that is less, because parent carers can't say, actually, I don't think we've seen the right person, I think we need to keep looking, if that decision has already really been made that we need to get somebody in post as quickly as possible. So that's a question to ask before going into the process. To what extent are we able and willing to share that decision making power?
Sorry,
And
Claire, just to interrupt. It's less, just under 10 minutes left then. Sorry.
thank you very much. Can parent carer involvement meaningfully influence the outcome, and is impact proportionate to the time and energy that would need to be invested? And these are the conversations, these are the decisions that you should be making together. In terms of the next step, scheduling interviews, try to scope parent carer availability first. What very often happens when parent carer is involved in a process like this is these first few steps that have already been undertaken, and actually sometimes the interviews have already been scheduled, or the interview windows have already been scheduled, when a parent carer forum gets a call to say, could you please send a representative? And so that's very clearly where we're drawing a line between sort of engagement and participation and genuine co-production. So try to scope parent carer availability first to allow parent carers to equally participate, and make that decision together about what that's going to look like, whether if you're early in the process, whether the parent carers are going to help with the role profile and perhaps submit a question for the interview panel but won't be directly involved, or perhaps they'd like to be involved but feel it's a bit too much to be part of the panel, or maybe the same parent carer can't commit for all of the interviews, so you'd like to be involved as observers instead. Make those decisions together, and consider equity and access in all types of participation. It is very, very difficult to be the only parent carer in the room, and arguably to make that equitable, we should have ideally an equal number of parent carers and professionals and practitioners involved in participation. Obviously, the interview panel is one place where it probably really isn't possible to do that. But think about the impact on that parent carer. Perhaps the other members of the interview panel are people that work with each other very regularly and know each other well, and perhaps the parent carer doesn't know them at all, or doesn't know them very well. Perhaps you need to think about getting together before the interviews, just so that everybody can get to know each other, and the parent carer involved can feel a little bit more comfortable. And is information accessible? And this is one place where it's a real opportunity to improve the recruitment process if you're involving parent carers early. Because it could be that if you have those early discussions, when going out to advert, you specify to candidates, we want to see your CV in an easy read version, which means that the information will be accessible to any parent carers, or indeed children and young people that participate in the interview process. It also helps you as recruiters be able to establish whether candidates already have those skills to be able to create accessible information resources, and are practiced and experienced in that way of working. So I have created a little roadmap that you can apply to lots of different situations to make that evaluation of whether you're in a co-production space or a participation or engagement space. So right at the beginning, think why. What's the motivation for involving parent carers? What do you hope will be better or different as a result? And having a clear vision of what that's about. Where are you in the process? Have decisions already been made? Are you early enough in a process? Is there enough of a blank sheet of paper for you to be able to genuinely co-produce? Are you working under time or financial or other constraints, and have you been transparent about that? Would they present a barrier to co-production, or are they things that you can work around? Is it going to add value? And this is something you should decide together. Is it a good use of everyone's time and resources? Will parent care involvement make a meaningful difference? I think one issue that parent carers sometimes report is that they sometimes feel like their participation is a tick box exercise, and it isn't making any meaningful difference, and that a lot of their time is not wasted, because that's too harsh a word, but could be better used on projects where parent carer participation will make a difference, rather than them feeling like they're just in the room sort of observing what's happening and not really having an impact on that. So ask, does it add value? Is this something we're going to do together? Is it good use of parent carers' time? And if you're having those conversations and following those road signs that are above the dotted line, the chances are that you're in a co-production space. You're asking the right questions and to make that evaluation of whether you're going to work together and if it's co-production. If you're below the dotted line, you're probably more in a participation and engagement space where you're thinking about the accessibility of the process in terms of venues and timings of meetings and accessibility of information. So hopefully I've left a little bit of time for questions and comments. Thank you all very much for listening, and I will attempt to stop screen sharing now.
Yeah, so there's one comment in the chat saying that this is very valuable feedback. I think that was towards the start of the presentation, but yeah, just if anyone has any questions, if they want to raise their hand, or they can type it into the chat.
Claire, hi, I'm Madeline Gibbs. I'm the NHSE South East End advisor, and I just wanted to say thank you for some of those top tips, I guess, and something for us to take away, particularly in healthcare, because the churn is so great. So there's not a question really, it's more of a comment for us to take away and think about and reflect on how do we build that in and have true co-production from the very outset, without it being feeling tokenistic, or that it's just something that it's, oh my god, we forgot parent carers, you know. So yeah, thank you. It's just a thanks really for like to help us reflect on that.
Thank you.
I'd also like to say I had a parent carer in my interview. I've only recently come into post, and it's actually been really good for me because I've gotten into the parent carer forum because I've met them already in my interview. So actually, you know, it benefits everybody to have people. Hello. So yeah, it really benefits everybody because it means that you have you know people when you come in. So that I just think that's really important.
Thanks, Claire.
Actually, I have a question now. So you talked about totally understand, you know, one parent carer amongst many different professionals across education, health and care. It can be quite I guess quite overwhelming, and also the language between the three different agencies are sometimes a bit different as well. So you mentioned that we should have equal numbers of parent carers to professionals, and I think more parent carers is great, but I suppose how do we manage that? Because sometimes parent carers send one or two representatives. Should we say, oh, do you think we should ask for more? And you know, how do we approach it really without offending really? Yes.
It's really tricky, and there's some circumstances where it just isn't possible. The interview panel is one, and some quite high level boards and things like that, you know, it really wouldn't be feasible for more than one or maybe two parent carers to be included. I'd say as a baseline, try to invite two, because then they're there to support each other. Also, the reality of our lives as parent carers is that sometimes our availability can be unpredictable. Things happen with our children and young people, so it's good practice for parent carers to be able to buddy up in the event that one of them has a crisis and unfortunately can't make a meeting or event. So I would say trying to include two spots for parent carers as a minimum is quite helpful, and just creating those opportunities where there is more flexibility to meet with wider groups of parent carers and hear that wider view. And that can sometimes be the other way around, where you've got maybe one or two professionals in the room and a very large group of parent carers, and on the flip side that can feel a little bit intimidating and overwhelming for professionals. So in an ideal world, we'd be creating opportunities to come together with an equal mix of parents and professionals.
We also have a question, Victoria, if you want to jump in.
Yes, it's not really a question, it's a comment. You mentioned about making it very accessible for parent carers, but sometimes you need to remember that we are not just parent carers. Sometimes we have got careers we've had to give up. We have got knowledge of completely massive chunks of different systems that we're not able to use, and we're actually using it in send improvement, and sometimes it gets forgotten that we can be experts in more than just our own children. And I think that's a really key part of co-production working well, is that you respect that everybody's got a lot of knowledge, just you don't necessarily know it there yet.
Well, you're right. It's a key part of co-production to use the skills that everybody and the capabilities that everybody has. And in terms of information resources in particular, it's a real gap, because, as you said, parent carers that have got professional skill set can sometimes feel that some information resources are a bit patronizing. And that they just need something that's in plain English and is quite succinct. I think we're all quite time poor people as parent carers, and we may have the capability of understanding that 50-page project document. We just don't have the time to plough through it, and we need somebody to have summarised that in an accessible and concise way. So I think, yeah, we absolutely need to respect the skills and the constraints that everybody's working under, and that's a real gap.
Thank you.
Just an additional comment in the chat. I guess this goes back to taking time to getting to know your PCF well and build on the partnership. So yeah. Okay, well, I think if there's no other questions or comments, that's great. Thank you everyone for attending. That was great, Claire. Thank you.
Thank you. Thanks for having me.
Great. Thank you. Bye.
Thanks, Claire. Thank you.